So today is Sunday, January 25th. I just got to the hospital to see my mom, and they are telling me, well, she survived the extubation and she's doing well today, but they want to discharge her tomorrow, and they are trying to force me to discharge her back to the nursing home that broke her hip. And I'm saying absolutely not. My mom is in a lot of pain. And I said I need time to make arrangements. I'm going to have to bring her home. That's what has to happen. I'll be able to take care of her myself temporarily, and then I'll figure the rest out. This is pain. So guys, my whole life is going to be turned upside down. I'm going to document this journey. Please send your prayers up for her. Please subscribe. That'll help me so that I can generate some income on my channel so that I can hire some staff. I'm going to piece all of my videos together. I don't know what kind of order they're going to be in. She's in the ICU still. They want to what's called step down, which is to take her down to the next level of care, but then they want to discharge her. Hey YouTube, this is Catching Up with Crystal. Can you keep up with me? Because you never know where I'm going to be. And today this is going to be episode number 5 of the Yvonne project. For those of you who are just tuning in, my mother sustained 2 broken hips in a nursing home in 2 years. This last episode, they said they don't know what happened. The ER doctor told me that the story they told, whatever it was, did not match the injury. My mom sustained an injury that required surgery. For those of you who are just who are returning, thank you for returning. If you have not subscribed, please subscribe. It's gonna help because once I become monetized, that money I make will help me in the future with my mom. But we'll get to that. So I'm keeping a diary of everything that has happened. So where we left off in the Yvonne vlog was my mother was extubated, and meaning they took her off the ventilator and they wanted to discharge her. And I argued with the case manager. So FYI, they cannot ever discharge you from ICU. Sometimes you have people that work in places that don't know the system that they work in, and you can never, ever be discharged from ICU. Let me say this, unless you act in a nut and there's circumstances where people have been discharged from ICU, but it's more like they went against medical advice, but other situations, but I digress. Okay, so let's get to the point. So now, last we left off, we were on January the 24th. Today, we're January the 25th. Okay, so my mom was transferred from the ICU in the evening of Friday, January the 24th. And so they have to step you down. So here's ICU, and then you go to a medical unit or whatever, cardiac unit, if that's your issue. But my mom was stepped down. The reason they do not discharge you from ICU, you was jacked up enough to be in the ICU. Something can happen and you can regress. So this is what happened with my mom. I don't know why they didn't pick it up. So let's recap. My mom was on a ventilator. My mom had a broken hip. The nursing home said they didn't know what happened. Transfer her to the emergency room. ER doctor said it didn't match. My mom had to have surgery. She lost blood. She couldn't breathe on her own, and she was a DNR DNI, which meant she never was supposed to be on a ventilator. My mom I talked to palliative care. They're gonna take her off with comfort meds. Argued with the doctor, the ICU doc, who was not the palliative care nurse doctor that next day, who was just going to cold turkey my mom, despite signs that my mom was agitated. and she needed medication to assist her off of the ventilator. My mom survived the extubation, and they said they wanted to discharge my mom. I was like, slow your roll. No. And it wasn't so much the doctors. I'm not going to say that. It was the case manager who was like, we're discharging your mom. I was like, no, lady, bye, girl. You don't even know what you're talking about. They stepped her down to another unit. So today we're January the 25th and we're on Saturday. My mother is still not allowed to eat. So she hasn't been eating because she's had the tube in her mouth, right? So she can't eat yet. They need to determine that everything is okay with my mom. She cannot eat yet. The case manager is blowing up my phone left and right, talking about discharging my mom. Do not let them bully you. Do not let them bully you into making any decisions. And I'll make another video about that because me and this case manager were going toe to toe. Because they wanted to discharge my mom. My mom was not able to return to that nursing home because that she came from that broke her hip for the second time because it was not a safe place to discharge her to. And keep in mind, like I kept telling the case manager lady, y'all just said my mom was dying and I was not looking at nursing homes. I was looking at funeral homes. Okay. So, anyway, so she's on another unit. And if you're squeamish, turn away because I will be inserting pictures. My mother had a low hemoglobin. So her hemoglobin, I think it was 5 something. Yeah, it was like around 5 something. And so she should have been above 7 is where she should have been, but she was like 5 something. The normal range would have put her, let's say, anywhere between 12, 14, 16 would have been great for her. But anywho, she was at 5. So she was losing blood somewhere, and they didn't know where she was losing blood. And I spoke with the doctor. And let me say, other than that one incident in the ICU with that doctor, my experience with my mom in the hospital has been awesome. Even though I was going toe to toe with the case manager, I get it. She wanted that bed. Somebody else could have, used that bed after they got my mom stabilized. We'll do that in another video. My experience with the hospital was awesome. And maybe I'll give them a shout out later in another video, but I really did have a positive experience. And the one doctor came to me, he said, listen, your mom has a bleed, a GI bleed. So meaning somewhere from her mouth to her tutor, there was an opening somewhere and she was losing blood. And so he said to me, do you want us to consult GI, which is gastroenterology? Do you want us to consult GI? Because if we consult GI, they will have to put your mother to sleep again and to do the procedure. So what they would do is they would probably go in down her mouth. They'd stick a tube down her throat again and maybe one up her butt to see where this bleed is coming from, because she was pooping black tarry stools, and black tarry stools is a sign that you are bleeding somewhere. And so he said, do you want me to consult GI? We'll have to put your mom to sleep again. Now keep in mind, that's what got my mom in trouble the first time, because she didn't do well coming off of that anesthesia on top of being snowed. So he said we could do that, and I made a face. And he said, or we could just give her iron and a blood transfusion. And I said, let's do the iron and the blood transfusion. Because here's the thing. My mom had a GI bleed before, and they never found where it was from. They never were able to find the bleed. So they gave her blood, gave her iron. She recouped on her own. That was a few years back. But she did recoup on her own. But here we are again. She's got a GI bleed. And here's the thing. With patients, the doctor should always try the least invasive option first, right? you don't want to go in with the big guns right away, because the big guns is usually going to be a higher risk, maybe more pain. So I agreed to the blood and the iron. So if you're squeamish, if I haven't already inserted the picture or maybe made it my thumbnail, then yeah, turn away, because I'm showing a picture of my mom getting blood. I'm keeping all of this real with you guys. So they, you know, I went in to see my mom and I was talking to her, and she, you know, was she was still kind of out of it and everything. Like, she knew me and everything. Like, she knows me. She's got dementia, but she knows me. You'll see in the video. But anyway, or in the coming videos, you'll see. I hope I didn't make this too long. But anyway, so that's what happened. They had to freeze all discharge plans because my mother was not stable. She was bleeding. And so this is the thing. They rush you out of the hospital, and you're not always ready to go. And again, have somebody who can advocate on your behalf, because they are tough, but you know, you got to be tougher. So that's where we are. On Saturday, the 25th, my mom ended up needing blood. And she got 1 unit of blood. I'm looking. And her hemoglobin came up to 8.6 after the unit of blood, and they gave her iron. So that's basically it. I did go to the nursing home with my daughter, and we took my mother's belongings because I knew we weren't going back there. And I'm going to tell you about that situation too. So that's where we are. So today we covered the 25th and the 26th. Let me just say that because I'm looking at my notes and some of these things overlap. 25th and the 26th, my mom was transferred from the ICU to the 5th floor. She wasn't eating. They were still pushing for discharge. Then they found out my mom's hemoglobin was very low. She had to get 1 unit of blood and some iron. I made the decision not to put her through GI consult, where they would have to scope her and put her under anesthesia again. So that's it, guys. This has been Catching Up with Crystal. You have caught up with me. I will be still posting my regular life, but I will always put the Yvonne vlog or the Yvonne project in the comment section, so that you know, if you're following the story, you know to click on that video, and not if you're not interested in the other things I do in my life. So, all right, guys, please like and subscribe. Don't forget to hit that bell so you know when new content is posted. And I appreciate you, and I will see you in the next video. Thank you.